Many living in the downtown Eastside know about loss, like Angel Gates, a resident of the neighborhood for more than 30 years.
Every time I hear a siren, I wonder if it's going to be somebody else that I know. Excuse me. There's too many people. It's just too much now, but we need help.
She has personally lost 75 people to overdoses, including her best friend and the father of her eldest child.
We have a heart in the downtown Eastside that is dying. Like everybody thinks they're so vicious and violent because people use, but exactly that's the opposite of what it is. Because people are broken, they use.
And as the number of deaths continue to climb in BC, more than 4,500 since 2016, Gates is demanding action.
We need to see a safe supply. People are dying.
And she has a reminder for those running to represent her in the upcoming federal election.
We vote, so keep that in mind.
Well, we tracked down the leading candidates for Vancouver East to find out where they stand on decriminalization and a safe supply of clean drugs, a recommendation by both experts and frontline workers. First, the Liberal.
This is a health issue, and that's exactly how I see this. Our first bottom line is we have to save lives.
He says he can appreciate the idea of a safe supply.
And I'm a scientist in the background that I have of anytime there's a contaminated source, you try and clean up the contamination as an immediate step.
But he stopped short of endorsing safe supply or decriminalization. Next, the Green candidate.
I think it's time for some immediate action in this neighborhood. I'm tired of seeing my neighbors suffer.
As to what that action is,
I think a safe supply. By controlling the supply, we can prevent unnecessary deaths and prevent contaminated supply to opioid users.
The NDP candidate supports both, but took it one step further with a specific plan on how it should look.
When I talk about safe supply, I'm talking about for the doctor to make that determination. I'm not a doctor. I'm not going to sit down and prescribe for someone. This is what is appropriate for you. We should leave that to the medical experts to make that determination.
After spending the last 4 years in Parliament representing the riding, Kwan has a sense of frustration.
Canada, we have, I think, the ability and the capacity to address this issue. The real question is, why aren't we?
As for the Conservative candidate, he declined an on-camera interview, but says his party is against decriminalization and a safe supply, arguing for a more comprehensive option.
We need to work towards building a system of care that everyone who struggles with addiction is offered a treatment and a pathway to recovery. The cycle of injection, overdosing, and reviving with no adequate assistance to get addicts treatment into recovery is simply not the type of health care that Canadians deserve.
But for Gates, regardless of who is elected, she says the time for action is now.
Really, the bottom line is these are human lives. And what does a human life really cost?
Joel Ballard, CBC News, Vancouver.